Men over 60, 10 critical mistakes to avoid before getting a blood test. Marcus Wells, board-certified physician helping Americans 60+ protect their health and live fully. If you're over 60, chances are your doctor has recommended routine blood work, whether it's to monitor cholesterol, blood sugar, kidney function, or hormone levels. And while many people assume a blood test is a simple process, just head to the lab, roll up your sleeve, and check it off your list, the reality is a bit more complex. What most people don't realize, especially those in their 60s and beyond, is that what you do before your blood test can significantly affect the result. That cup of coffee in the morning, it could raise your blood sugar. Skipping your regular blood pressure pill, that might throw off your cardiovascular readings. Taking your usual supplements, some of them can actually interfere with hormone or thyroid test results without you even realizing it. And when you're in your 60s, you don't want false readings leading to unnecessary stress, extra trips to the doctor, or even the wrong diagnosis. I've seen it happen far too often. Patients end up with abnormal lab values, only to find out later that their preparation was the problem, not their health. As a physician with over 25 years of experience, much of it working directly with older adults, I've walked thousands of Americans through the process of getting accurate and reliable lab work. And one thing is clear, being prepared makes all the difference. That's why in this article, I'm sharing the 10 most common, and most avoidable, mistakes people make before blood tests, especially those over the age of 60. These mistakes may seem small, but they can lead to delayed or incorrect diagnosis, repeat lab visits and additional costs, unnecessary medications or procedures, emotional stress and confusion for you and your family. The good news: every one of these issues can be prevented with the right information. Whether you're getting blood work for your annual physical, managing a chronic condition like diabetes or high blood pressure, or tracking the effects of a new medication, this guide will help you take control of your results and work smarter with your doctor, not harder. You've worked hard to get where you are in life. Don't let a simple oversight before your blood draw derail your care. Let's walk through each mistake together so you can feel confident, informed, and ready when it's time for your next lab appointment. Let's get started. Not fasting properly, and it's more than just no food. For many adults over 60, routine blood work becomes a regular part of managing health. Whether it's monitoring cholesterol, blood sugar, or kidney function, your doctor may ask you to fast before your test. But here's where many people, especially older adults, make a critical error. They misunderstand what fasting really means. Fasting isn't just about skipping breakfast or avoiding solid foods. In medical terms, fasting means you should consume nothing except plain, unflavored water for a specific number of hours, usually between 8 to 12, before your blood draw. That includes avoiding coffee, even black tea, including herbal and green, fruit juice or flavored water, milk or cream, even a splash, artificial sweeteners, chewing gum or mints. For those in their 60s and older, these small exceptions may seem harmless, but they're not. Even a tiny amount of flavor, sugar, or calories can alter your blood test results significantly. For example, drinking coffee with cream can cause a spike in blood glucose, insulin, and triglycerides, 3 key markers we use to screen for metabolic issues like prediabetes, type 2 diabetes, and high cholesterol. I'll never forget a patient in his late 60s who came in for a routine fasting blood test. He told me confidently that he hadn't eaten anything in 12 hours. But when I probed a little further, he casually mentioned drinking his usual morning cup of coffee, with just a touch of cream. His results showed elevated blood sugar, and we nearly diagnosed him with diabetes. In reality, it was the cream in the coffee that caused the spike, not a chronic condition. These kinds of misunderstandings are more common than you'd think, especially among older adults who've been having blood work for decades but were never clearly told what fasting truly involves. Misinterpreting the results can lead to unnecessary repeat testing, anxiety, and in some cases, the wrong treatment plan. If your doctor orders a test that requires fasting, especially lipid panels or advanced cholesterol profiles, a full 12-hour fast is often necessary. That means if your appointment is at 9 a.m., your last bite or sip, besides water, should be no later than 9 p.m. the night before. For older Americans, especially those managing multiple chronic conditions, clear communication is key. Always ask your healthcare provider these 3 questions before a fasting blood test. How many hours should I fast? Is water allowed? Should I continue taking my morning medication? Don't assume. Ask. The more precise you are with your preparation, the more accurate and useful your results will be, saving you time, worry, and potential complication. In your 60s and beyond, your health decisions carry even more weight. Getting your blood work done right the first time ensures your doctor has the right data to support you, not mislead you. It's a small but powerful step toward better, safer care. Fasting too long or skipping, a hidden risk for adults over 60. While most people understand they need to fast before certain blood tests, many take this instruction to the extreme, especially older adults who are trying to be cautious. I've had countless patients over 60 who thought, if 8 hours is good, 16 hours must be even better, or who skipped all their medications to avoid interfering with lab results. But here's the truth. Overfasting or skipping your regular medications can be dangerous, particularly as we age. Let's break it down. Overfasting isn't safer, it can be harmful. As we get older, our bodies don't regulate blood sugar as efficiently as they used to. For people with diabetes, especially those taking medications like glipizide, glyburide, or insulin, fasting longer than prescribed can cause hypoglycemia, or dangerously low blood sugar. This isn't just about feeling a little shaky. In adults over 60, hypoglycemia can result in dizziness or confusion, loss of coordination, fainting or falling, which increases fracture risk, emergency hospitalization. Even if you're not diabetic, extended fasting can still affect your energy, balance, and cognitive sharpness, especially if you're taking multiple medications or dealing with age-related changes in metabolism. Skipping medications, just in case, can be even riskier. Some people worry that medications like blood pressure pills will skew test results, so they stop them without checking with their doctor. That decision can backfire quickly. Missing even one dose can cause your blood pressure to spike, putting you at risk for a heart attack or stroke. Seizure medications, suddenly stopping these, even for one morning, can increase your chances of having a seizure, especially if you've had one in the past. Thyroid medications, heart meds, or diuretics. Skipping these may not only impact your lab results but also destabilize your condition, particularly if you're being monitored for chronic disease. And let's not forget, Americans over 60 are often managing multiple chronic conditions at once. That means more medications, and more potential complications if you stop them abruptly. So, what should you do? The key is clarity, not guesswork. Before your scheduled blood test, talk with your doctor or pharmacist and ask these 3 questions. Do I need to fast for this test? If so, for how long? Should I take my morning medications as usual? Are there any medications or supplements I should skip temporarily? Your healthcare provider can tailor their advice based on health history, the medications you're on, the specific lab tests being performed. For example, if you're getting your blood sugar or lipid levels checked, you may need to fast, but should still take your blood pressure medication with a sip of water. In contrast, if you're having a thyroid panel done, fasting might not be necessary at all. Final thought. For older adults, especially those over 60, the goal is to prepare smart, not extreme. You don't need to overcompensate by fasting too long or stopping essential medication. In fact, doing so can put you at unnecessary risk. Always check with your healthcare provider in advance. A 5-minute phone call could prevent a fainting episode, a trip to the emergency room, or a misdiagnosis. Taking a cautious but informed approach ensures that your test results are accurate, and that your body stays safe in the process. Here's why it matters for adults over 60. Staying active is one of the best things you can do for your health, especially as you age. Regular physical activity supports heart health, bone density, mobility, mood, and energy levels well into your 60s and beyond. But when it comes to blood testing, timing your workouts matters more than you might think. Many older adults make the well-intentioned mistake of hitting the gym or going for a vigorous walk the morning of their blood draw, believing that exercise will only reflect positively on their health. Unfortunately, this can lead to misleading lab results, even if you feel perfectly fine. Let's break down why intense exercise right before a blood test can create problems. Temporary changes that skew your result. When you engage in high-intensity activities, such as weightlifting, resistance training, long-distance walking, or cycling, your body undergoes physiological changes that are completely normal. However, these changes can be misinterpreted when looking at blood work. Here are some of the key markers of creatine kinase. After strenuous exercise, your muscles release an enzyme called CK into your bloodstream. Elevated CK levels can resemble the pattern seen in actual muscle damage or inflammation, which may alarm your doctor unnecessarily. Creatinine. This waste product is filtered by your kidneys. After a workout, your creatinine levels may rise due to muscle breakdown, making it appear as though your kidneys aren't functioning as well as they actually are, especially concerning for those over 60, as kidney health is closely monitored in older adults. Liver enzymes. Physical exertion can also cause a spike in liver enzymes like AST and ALT. If these appear elevated, your doctor may suspect liver issues, prompting additional tests or even referrals to specialists. Blood glucose. Exercise increases the body's energy demands, which can temporarily elevate blood sugar levels. This can confuse your doctor if they're monitoring your glucose for prediabetes, diabetes, or insulin resistance, all of which are more common in people over 60. Why this is especially important for seniors. As we age, our bodies become more sensitive to metabolic shifts. Healthcare providers are often watching lab results more closely for signs of chronic conditions like diabetes, heart disease, kidney disease, and liver issues. Even a temporary change caused by exercise can raise unnecessary red flags, leading to repeat tests, anxiety, and potentially costly medical evaluations that could have been avoided. In fact, one of the most common reasons patients over 60 are asked to return for retesting is due to test results that were skewed by something they did, like working out, just hours before the blood draw. What you should do instead. To ensure your blood test results reflect your true baseline health, here's what I recommend. Avoid intense exercise for at least 24 hours before your blood test. This includes any activity that raises your heart rate significantly, causes muscle soreness, or involves weight resistance. Stick to light activity. If you need to move around or stretch, that's fine, just avoid anything that feels like a workout. Give your body time to rest. A day of recovery before your labs not only supports accurate readings but is also a healthy part of any fitness routine, especially for those over 60. Bottom line. While exercise is a powerful tool for aging well, timing is everything when you're getting your blood drawn. Let your body settle and recover before heading to the lab. It's one of the simplest ways to avoid confusion, retesting, and unnecessary concern, giving both you and your doctor the clearest possible picture of your health. Marcus Wells, board-certified physician helping Americans over 60 thrive. Not drinking enough water, a common yet costly oversight for adults over 60. As we get older, our bodies naturally undergo changes that can affect everything from metabolism to thirst perception. Many adults over 60 simply don't feel thirsty the way they used to, and that can become a real issue when it comes to preparing for blood work. Dehydration is one of the most common, and most overlooked, reasons for inaccurate or difficult lab results. And here's why it matters. Dehydration makes blood draws more difficult, especially for aging veins. If you're not well hydrated, your blood volume decreases slightly and your veins become less plump. This makes it significantly harder for the phlebotomist to locate a good vein, especially in older adults, whose skin may already be thinner and whose veins may be less elastic. Result: more pokes, more time in the chair, and often, more discomfort. Concentrated blood can distort key lab values. When you're dehydrated, your blood becomes more concentrated. That means the levels of substances in your blood, like creatinine, sodium, potassium, and urea nitrogen, may appear artificially elevated. For someone in their 60s or 70s, this can be especially misleading, as physicians may interpret these numbers as early signs of kidney dysfunction or electrolyte imbalance. That could trigger unnecessary follow-up tests, cause concern about conditions that aren't actually present, or even result in inappropriate medication adjustments. Hydration directly affects kidney function result. The kidneys are responsible for filtering waste and maintaining fluid and electrolyte balance in the body. When you're dehydrated, your kidneys have less fluid to work with, which can lead to a temporary dip in performance on your lab report. For seniors, where even slight changes in kidney function are monitored closely, this can raise false alarms. I've seen patients over 60 sent for additional nephrology consults or imaging studies based solely on labs that were skewed by nothing more than a lack of water intake. Aging decreases natural thirst, so you may not realize you're dehydrated. One important factor many people in their 60s and beyond don't realize is that the sensation of thirst becomes less reliable with age. You may not feel thirsty even when your body needs fluids. That's why it's important to make hydration a conscious habit, especially the day before and morning of your blood test. So, what should you do? Start hydrating the day before. Don't wait until the morning of your blood draw to start drinking water. Begin sipping water steadily throughout the previous day. Aim for around 6 to 8 cups unless your doctor has placed you on a fluid restriction. Drink a full glass of water 1 to 2 hours before your test. Even if you've been instructed to fast, water is usually allowed, and highly recommended. Only in very rare cases, such as before sedation or certain specialized tests, is water restricted. Double check with your doctor if you're unsure. If you've been told to fast, and you're not sure whether that includes water, call your doctor or the lab in advance. But for most standard blood tests, including cholesterol, glucose, kidney panels, and complete blood counts, water is not just allowed, it's encouraged. Final thoughts for adults 60 plus. In my experience as a physician caring for Americans over 60, hydration is one of the simplest ways to make your blood test more comfortable and more accurate. It's also one of the most overlooked. By staying properly hydrated before your blood work, you make the process easier for you and your care team. Improve the reliability of your test result. Reduce the chances of repeat testing or misinterpretation. It may seem like a small step, but for older adults, it's a powerful one. So next time you have a lab appointment, don't just fast. Hydrate smartly. Your body, and your doctor, will thank you. Avoid blood tests right after drinking alcohol or while you're sick. As someone over 60, you know how much your body changes with age. And that includes how your body processes things like alcohol and medication. That's why it's so important to time your blood tests wisely, because lab results are only helpful when they reflect your true, everyday state of health, not a temporary fluctuation. Why alcohol can mislead your lab result. Let's say you've just returned from a trip, maybe a long weekend with friends, a cruise, or a family celebration. You enjoyed a few drinks, maybe more than usual. That's completely normal and understandable. But, even a couple of nights of heavier than usual drinking can alter key lab markers for up to several days. Alcohol can falsely elevate liver enzymes. These are markers we use to assess liver function. Alcohol, especially in larger amounts, can temporarily cause them to spike, sometimes to levels that mimic liver damage. These blood fats can shoot up dramatically after drinking alcohol. This is especially important if your doctor is evaluating your heart disease risk or trying to manage your cholesterol. Blood sugar. Glucose. Alcohol can cause erratic blood sugar levels. It may raise your fasting glucose or even interfere with long-term markers like HbA1c in some cases. If you're not a regular drinker but just had a few drinks more than usual, these temporary shifts can be misleading. Your doctor might think something is seriously wrong, when in reality, your body is simply reacting to alcohol. For someone in their 60s, this matters even more. Liver function tends to slow with age, and older adults are more sensitive to the effects of alcohol. What you could handle at 40 might now cause more disruption than you expect. Illness can also throw off results. Consider you're recovering from a seasonal cold or a mild bout of bronchitis. You've been on antibiotics or over-the-counter medications, and you're not quite back to your normal routine. Maybe you haven't been eating well, your sleep is off, and your activity level has dropped. These factors, along with certain medications, can also cause changes in your lab result. Liver enzymes might rise due to medication metabolism. Kidney function might appear worse than it is due to dehydration. Inflammatory markers might be higher than usual as your immune system works to fight off illness. If you get your labs drawn during this period, your doctor might see values that don't reflect your normal health status and recommend unnecessary follow-up testing, or worse, adjust medications based on skewed results. What should you do instead? If your lab work isn't urgently needed, it's often best to wait until you've returned to your baseline, meaning you've had at least a few days of no alcohol. Full recovery from illness. A return to your usual eating, sleeping, and hydration habits. Of course, there are exceptions. If your doctor specifically ordered labs to evaluate how your body is responding to a medication, such as liver function tests while on statins or antifungal treatment, then the timing may be intentional. In those cases, follow your doctor's advice closely, but for routine blood panels, like cholesterol checks, liver enzymes, or blood sugar levels, timing is everything. A note for Americans 60 and older. As we age, our bodies take longer to bounce back. A weekend of indulgence or a week of illness can have a stronger and longer-lasting effect on our metabolism, our immune system, and our lab values. For that reason, older adults should be especially cautious about when to schedule routine blood work. The goal is to avoid false positives, unnecessary worry, repeat visits, and even inappropriate treatments. One of the best ways to do that is simply by giving your body time to reset before testing. Taking supplements that interfere with lab results, a hidden risk for older adults. If you're over 60 and working hard to maintain your health, chances are you're taking a few supplements, maybe even more than a few. But what most people don't realize, especially in their 60s and beyond, is that some of the most popular over-the-counter supplements can interfere with your blood test results, leading to confusion, unnecessary follow-ups, and even incorrect treatment adjustments. One of the most common culprits, biotin, also known as vitamin B7. Biotin is widely marketed for improving the health of your hair, skin, and nails, and it's found in countless supplements on pharmacy shelves across the US. It's especially popular among older adults looking to slow age-related changes in skin elasticity, nail brittleness, and thinning hair. But here's what you need to know. Biotin can interfere with certain blood tests, especially those related to your thyroid. Biotin itself isn't harmful. It doesn't damage your thyroid or your organs. But it interferes with the way laboratories measure key hormones, particularly TSH, the hormone your brain sends to your thyroid to regulate how fast your body burns energy. If you're taking biotin close to the time of your blood test, it can cause the lab equipment to underestimate your TSH levels. That means your test might show your thyroid is overactive, even if it's perfectly normal. For Americans in their 60s, this is especially important because many adults over 60 are being monitored for thyroid disease, which becomes more common with age. Misreading could prompt your doctor to lower your thyroid medication, even when it's not needed. Some people are wrongly referred to endocrinologists or ordered additional expensive testing, all because of inaccurate lab results caused by a supplement. Real-life example from my practice. I once saw a 62-year-old patient who had been feeling more tired than usual. Her labs came back showing low TSH, which typically signals an overactive thyroid. But when I asked about her medications and supplements, she casually mentioned she was taking a beauty blend that included 5,000 micrograms of biotin daily. We paused the supplement for several days, retested her labs, and, sure enough, her TSH was perfectly normal. No thyroid problem, no need for new medication, no need for an unnecessary referral. How to protect yourself. If you're taking any supplement that contains biotin, and this includes many popular anti-aging blends, multivitamins, and skin nail formulas, you need to stop taking it at least 2 to 3 days before your blood test. In some cases, especially with higher doses, your doctor may advise you to stop even earlier. Also, be sure to always tell your healthcare provider that you're taking biotin. This simple step can prevent misdiagnosis and save you time, stress, and money. Final thought for adults 60 and older. Many older adults are doing the right thing by investing in supplements to support aging gracefully. But unless you're aware of how those supplements can affect your lab work, you might unknowingly complicate your care. So if you're over 60 and getting ready for a routine blood panel, especially one that includes thyroid function tests, take a moment to review your supplements. Check for biotin, stop it in time, and inform your doctor. It's a small step that can make a big difference in ensuring your health decisions are based on accurate information, not distorted data. But what many people don't realize is that when you get those hormone tests matters just as much as what you're testing. Hormones don't stay the same throughout the day, they follow natural daily rhythms, and ignoring that timing can lead to false results, wrong diagnoses, or unnecessary treatments. Let's break it down. Testosterone. Morning matters, especially for men over 60. For men, testosterone levels are usually highest in the early morning, typically between 7 a.m. and 10 a.m. After that, levels drop gradually throughout the day. If you're a man in your 60s or older and your testosterone is tested in the afternoon, you may see an artificially low number, even if your body is producing enough testosterone for your age group. That can lead to a diagnosis of low T when you may not truly have it, which in turn could lead to unnecessary treatments, including testosterone replacement therapy. Why does this matter? Testosterone therapy can have side effects, including increased red blood cell count, fluid retention, and risk of prostate enlargement. Many men are prescribed testosterone based on a single test done at the wrong time of day. Always schedule testosterone testing in the early morning, ideally before 10 a.m., and make sure you've had a good night's sleep. Your levels should be tested more than once before making any decisions about treatment. Cortisol, one hormone, two different testing goals. Cortisol, your primary stress hormone, is another hormone that fluctuates on a daily cycle. Its levels are highest in the morning and lowest around midnight, in people with a healthy circadian rhythm. But how we interpret cortisol results depends on what we're looking for. If we're testing for cortisol deficiency, for example, if your doctor suspects Addison's disease, then we want to test your cortisol early in the morning, usually around 8 a.m. If your levels are low when they should be high, that's a red flag. If we're testing for cortisol excess, like in Cushing's syndrome, we want to test when cortisol is supposed to be at its lowest, at night. That's why a common test is the midnight salivary cortisol test, where you collect a saliva sample at home and mail it to the lab. Why sleep and routine matter. Here's something many older adults your sleep habits directly influence hormone levels. If you were awake all night due to travel, shift work, insomnia, or stress, and then go for blood work at 8 a.m., your results might not be accurate. That's because sleep deprivation disrupts your body's internal clock, affecting cortisol and testosterone levels. The lab compares your results to standard ranges based on people who slept through the night. If you didn't, your levels may look off even when nothing is truly wrong. So, if you're planning to have hormone testing done, make sure you're well rested. Stick to your normal routine the night before. Let your doctor know if you had a poor night's sleep, traveled across time zones, or had unusual stress. For women over 60, timing can still play a role. Although postmenopausal women don't have the same monthly hormone fluctuations they did in earlier years, cortisol and thyroid hormones still follow a daily pattern. Poor sleep, illness, or testing at the wrong time can still interfere with accurate results and may influence decisions about thyroid management or adrenal support. Final takeaway. If you're in your 60s or beyond, getting your hormone levels tested at the right time of day is critical for getting the right answers and avoiding the wrong ones. Whether you're checking testosterone, cortisol, or other hormones, proper timing and sleep hygiene can help your doctor make informed decisions that truly reflect your health. Talk to your doctor before scheduling labs. What time of day should I get this test? Should I fast or not? Does sleep affect this test? Taking these small steps can mean the difference between an accurate diagnosis and months of chasing the wrong problem. Not telling your doctor about all medications and supplements. At your age, even small omissions can lead to big misunderstandings. Marcus Wells. If you're in your 60s or beyond, you've probably accumulated a long list of medications, vitamins, and supplements over the years. Maybe you're on a blood pressure pill prescribed a decade ago, a daily multivitamin, and recently started a supplement for joint support that your neighbor swears by. Or perhaps you joined a men's health clinic that prescribed testosterone injections or pellets to boost your energy. If your doctor doesn't know exactly what you're taking, they're working in the dark, and that can lead to serious consequences. Let me tell you about a patient I once saw. He was a 63-year-old man, active, healthy-looking, but his routine labs showed an unusually high red blood cell count. His primary care physician was worried. High red cells can be a red flag for rare and serious conditions like polycythemia vera, a bone marrow disorder. The doctor was preparing to refer him to a hematologist for a full workup. But when I sat down with him and asked a few extra questions, it came out that he had recently started receiving testosterone pellet therapy at a men's clinic. He didn't think it was important to mention. After all, it wasn't a prescription from his regular doctor. That missing piece changed everything. Testosterone therapy is a known cause of elevated red blood cell counts. It's not dangerous in itself when properly monitored, but if a doctor doesn't know you're taking it, they may misinterpret your labs, assume something seriously wrong, and send you down a path of anxiety, referrals, and expensive testing you didn't need. This issue is even more common now with the growth of telehealth services, online prescription programs, over-the-counter and herbal supplements, weight loss clinics, anti-aging and hormone therapy centers. Many of these services don't coordinate with your primary care doctor. And unless you tell your physician what you're using, it doesn't get documented in your medical record. Why it matters more after 60. As we age, our bodies metabolize medications differently. What was once a harmless supplement at 40 can start interacting with your heart meds or affect your liver enzymes at 65. Even something as natural as turmeric, fish oil, or magnesium can interfere with blood clotting, kidney labs, or thyroid testing. Doctors depend on a complete picture to interpret your test results accurately. That includes prescription medication, vitamins and minerals, herbal or natural remedies, hormonal therapies, like testosterone, thyroid extracts, injections, drops, pellets, creams, or patches. Everything counts. And if you're not sure whether something matters, tell your doctor anyway. Let them decide. It's far better to overshare than to leave out something that could change the course of your care. What you can do today. Bring a full list to your appointments, include brand names, doses, and how often you take each item. If you use a pill organizer, snap a picture and show your doctor. If you started anything new from a clinic, over-the-counter store, or online pharmacy, let your doctor know. Be honest. You're not being judged, you're being protected. Being transparent with your care team isn't just about doing the right thing, it's about making sure your test results are read in context. Especially after 60, when you may be managing more than one condition at a time, the clarity you provide can be the difference between accurate care and unnecessary intervention. Better communication leads to better decisions and better health. 9. Getting blood work too soon after changing medication. Why timing matters, especially after 60. If you're over 60 and managing chronic conditions like hypothyroidism, type 2 diabetes, or high blood pressure, chances are your doctor may occasionally adjust your medication. That could mean starting a new prescription or changing the dosage of something you've been taking for years. And while it's natural to want quick answers, to see if the new medication is working or causing side effects, testing your blood too early after a change can give you a misleading picture. Medications need time to take effect. Many medications, especially those that regulate hormones or blood sugar, work gradually. For example, thyroid medications like levothyroxine may take several weeks to fully normalize your TSH levels. Diabetes medications such as metformin or GLP-1 agonists require at least a few weeks to show meaningful changes in your A1C or fasting glucose. Even cholesterol medications like statins may not show full lipid changes until you've been on them for a month or more. Your body, especially after 60, doesn't always respond overnight. Metabolism tends to slow down, and organs like the liver and kidneys, which process most medications, may take longer to adjust. So testing just a few days, or even a week, after starting or changing a medication may result in labs that don't reflect the full therapeutic effect. This can confuse your doctor and lead to unnecessary changes in treatment or even additional testing you don't need. Why this matters for seniors. At age 60 and beyond, many Americans are managing multiple medications at once. If your doctor orders blood work too soon after a change, it may look like the new dose isn't working, when in reality, your body simply needs more time to respond. In some cases, your doctor may even think the medication is causing an adverse effect when it's just part of the normal adjustment period. This is particularly true for medications that affect thyroid hormones, free T4, blood sugar control, fasting glucose, insulin, kidney function, cholesterol and triglycerides, blood pressure medication. For older adults, interpreting lab values too early can cause overcorrection, medication fatigue, and even distrust in treatment, none of which serve your long-term health. How long should you wait? Unless your doctor has a specific reason to test earlier, for example, to check for side effects or monitor kidney safety, the general rule is wait 4 to 6 weeks after starting or adjusting thyroid or cholesterol medication. Wait at least 2 to 4 weeks for diabetes medications, depending on the drug. For blood pressure changes, your doctor may recommend checking blood pressure at home rather than rushing back to the lab. Always follow the specific timeline your doctor recommends. If you're unsure, ask, when should I get my labs done to make sure the medication has had time to work? Final thought. For Americans over 60, managing your health takes patience, and that includes being patient with your medication. The best way to get accurate, actionable lab results is to give your body the time it needs to adapt. That way, your care team can make informed decisions based on true, stable numbers, not premature snapshots. Your time is valuable. Your health is too. So let's get it right the first time. It's common to think you can wait until the very last minute to get your blood drawn before your doctor's visit, or even worse, to cancel or postpone your appointment if all your lab results haven't come back yet. This approach may seem convenient or less stressful at first, but it can actually cause delays in your diagnosis and treatment, and in some cases, even put your health at risk. Here's why this is an important issue. Lab processing times vary. Depending on the type of tests ordered, some results may take only a day or two, while others, like specialized hormone panels or genetic tests, might take longer. If you wait until just before your appointment to do your blood work, there's a good chance your doctor won't have all the information available during your visit. Partial results are still useful. Even if some lab results are pending, the tests that have come back might reveal critical information. For example, your doctor could detect early signs of kidney problems, anemia, infections, or abnormal blood sugar levels. Acting on these findings promptly can prevent complications, hospitalizations, or worsening symptoms. Delaying care can lead to worse outcomes. For seniors, timely diagnosis and management of chronic conditions like diabetes, hypertension, or heart disease can be life-saving. Skipping or postponing appointments because of incomplete lab results can delay important interventions, medication adjustments, or referrals to specialists. Your appointment is about more than labs. A doctor's visit isn't just about reviewing blood work. It's also an opportunity to discuss symptoms, medication side effects, lifestyle changes, and any new health concerns. Even without full lab data, your healthcare provider can help guide your care based on the information available. Plan ahead and communicate. To avoid last-minute stress, schedule your blood draw several days before your appointment. If you know certain tests will take longer, ask your provider about the best timing for labs and visits. If some results aren't backed by your appointment, don't cancel, attend and discuss the next steps, including when to follow up. For Americans over 60, maintaining proactive communication with your healthcare team is essential. Managing your health is a partnership, and timely lab testing combined with regular doctor visits helps ensure you stay on track. Remember, your health can't wait. Don't let timing issues interfere with the care you deserve. Show up for your appointments, review what's available, and work with your doctor to schedule any necessary follow-ups. For Americans entering their 60s and beyond, blood tests are far more than just routine lab work. They provide a vital snapshot of your overall health and can guide important decisions about your medical care. At this stage of life, staying proactive with your health is crucial, and getting accurate blood test results is one of the most straightforward, yet powerful tools you have to monitor how your body is doing. The way you prepare for your blood test has a direct impact on the accuracy of the results. Simple missteps, like eating or drinking something you shouldn't, skipping medications without medical advice, or not telling your doctor about all the supplements and treatments you're using, can lead to false readings. This can delay diagnoses, result in unnecessary follow-up tests, or even lead to treatments that you don't really need. By consciously avoiding the 10 common mistakes we've discussed, you're not only saving yourself the inconvenience and anxiety of repeating blood tests, but you're also ensuring that your healthcare providers get reliable information. This empowers your doctor to make the best possible decisions tailored to your unique health needs. Whether it's managing chronic conditions like diabetes and heart disease, checking hormone levels, or monitoring kidney and liver function, accurate labs are the foundation for effective care. For those over 60, your body goes through changes that can affect test results. Metabolism slows, hormone levels fluctuate, and the way medications interact can be different than when you were younger. This makes it all the more important to follow preparation guidelines precisely and communicate openly with your healthcare team. If you found these insights helpful, I encourage you to share them with your family members, friends, or caregivers. These are the people who might also benefit from knowing how to approach blood tests correctly. And don't hesitate to bring up any questions you have at your next doctor's appointment. Being informed and involved in your healthcare is one of the best steps you can take toward maintaining your independence and quality of life. Remember, knowledge is powerful, but it's most powerful when paired with action. Taking these small, thoughtful steps before your blood test can make a big difference in keeping you healthy, active, and confident as you enjoy your years ahead. Stay well, stay informed, and stay proactive.